Welcome to the Parkinsons Foundation's Wellness for Parkinson's Disease, Social Distancing at Home. My name is Krista Ellis, and I'm the Program Manager for the Parkinsons Foundation Florida and Gulf Coast chapters. Many thanks to all of you who are joining us today from around the region. Before we begin, I would like to thank our sponsors, UCB, Boston Scientific, Medtronic, and Amneal. Our programs would not be possible without the support of our sponsors, so thank you. Today, we will be exploring various subjects behind wellness for Parkinson's disease, where I hope to give you all some tools to live better with PD. I'll begin with a short about the Parkinson's Foundation introduction, and we will follow up with a presentation on the importance of movement. We will be guided through a movement break and come back to learn how to prepare for the hospital while living with PD. Dr. Calegan from the Neuromedical Center in Baton Rouge, LA, will join us to share tips on how to survive COVID while living with Parkinson's disease. We'll close with a live Q&A with all of our speakers, so please feel free to submit any questions you may have through that Q&A icon. And now I'd like to share a little bit about the Parkinson's Foundation. Better lives together. What does that mean? As a foundation, our mission is to make lives better for people with Parkinson's. And everything we do, we build on the energy, experience, and passion of our global Parkinson's community. The Parkinson's Foundation is the nation's leading community for people with Parkinson's disease, the people who love them, and all of those who are working to end the disease. With our presence in communities across the country and the globe, we have everything you need to live better with Parkinson's. We believe you deserve the promise of a cure and a better life today. The statistics support this urgency. There are 60,000 new cases of Parkinson's diagnosed every year in the United States, adding to the nearly 1 million Americans already living with the disease. Because of the aging population, we are confident that these numbers will increase substantially in the next 20 years. While there is no cure for Parkinson's, we know that treatments and expert care can greatly improve quality of life. The urgency of our mission translates into what we do. To achieve our mission, the Parkinson's Foundation pursues 3 goals: ensuring better care for everyone today, understanding Parkinson's through research tomorrow, and educating and empowering the Parkinson's community for us all. So let's talk about today. Each person's journey with Parkinson's is different, but for everyone, the first step in living better with Parkinson's is getting quality care. We support medical institutions that provide the best care for people with Parkinson's by designating them as a Parkinson's Foundation Center of Excellence. A Center of Excellence is a medical center with a specialized team of neurologists, movement disorder specialists, physical and occupational therapists, mental health professionals, and others who are up to date on the latest Parkinson's medications, therapies, and research to provide the best care. This network of 47 centers around the world provides expert care for nearly 150,000 people with Parkinson's every year. Evidence shows that quality care can improve quality of life dramatically, reduce depression, reduce the number of falls, and reduce the length of hospitalizations. The Parkinson's Foundation is actively working to identify and designate a medical institution in the Gulf Coast region as a center of excellence. Started in 2009, the Parkinson's Outcome Project is the largest clinical study of Parkinson's in the world. Through the Parkinson's Outcomes Project, we track the care of more than 12,000 patients in our Centers of Excellence network. With this study, we identify which treatments and therapies work best and share what we learn to educate both the person with Parkinson's and the professionals who care for them. Some critical findings from this study have already had a direct impact on how people navigate Parkinson's, such as depression and anxiety being the #1 factors that impact overall health of people with PD. Increasing activity to at least 2.5 hours a week can slow decline in the quality of life. just some of the many critical findings that we found from our Parkinson's Outcomes Project. Because quality care requires a team approach, we train nurses, physical and occupational therapists, and our medical professionals in best practices for PD care and equip them with the latest PD information. Through our helpline or website, we provide people with Parkinson's and their families a variety of free resources, including educational booklets and webinars, just like today's event. Our bilingual information specialists are available to help you with whatever you need. Information about treatments, helping to find local resources and support groups, referrals to care providers, and maybe just some support. Whatever it is you're looking for, we encourage you to come to us for quality resources. And now I'd like to take a few moments to talk about what the foundation is doing for tomorrow in advancing research toward a cure. We invest more than $10 million every year to study Parkinson's, what causes it, and how to treat it, and how to cure it. In the last 60 years, the foundation has funded more than $330 million in groundbreaking research, changing the way we diagnose and treat Parkinson's. We recruit and support promising scientists to make the breakthroughs that can lead to better treatments and a cure. Today, hundreds of foundation-supported scientists are aggressively researching what causes the disease, from genetic factors to environmental factors. We use the expertise of our PD community, who help us identify needs and drive cutting-edge research on the issues they care about most. For example, we are creating the first research agenda to improve the care of women with PD and to address long-time gender disparities in research and care. And we continue to expand and learn from the more than 12,000 people with Parkinson's who are enrolled in our Parkinson's Outcomes Project. So what are we doing to bring our communities together to advocate for and empower people with Parkinson's? We believe leading our community starts with listening to it. We have established the People with Parkinson's Advisory Council. This patient leadership group helps to make sure the perspective of people living with Parkinson's is at the center of all that we do. Through our Parkinson's advocates and research, we bring together researcher and people with Parkinson's to inform research priorities and influence studies and stakeholders. Our Moving Day events are the nation's largest grassroots Parkinson's events. We have one coming up in South Alabama, and I believe that is April 17th. And we have another in Baton Rouge in May. Since 2011, these walks have raised more than $22 million to support research, our Centers of Excellence network, and provide education resources and programs across the country. Through our Centers of Excellence, local chapters, volunteers, advocates, and staff across the country, we bring people together to educate and empower people with PD. Whether you are newly diagnosed or in later stages of Parkinson's, we have the resources to help you connect with a community of people who understand what you're going through. And so I'd like to highlight some ways that you could stay involved with the Parkinson's Foundation during this unique time. Each week, the Parkinson's Foundation hosts a virtual experience that we call PD Health at Home. We host a Mindfulness Mondays where we are addressing meditation and how to live mindfully, which helps reduce stress in everyday life. We also host weekly educational programs called Wellness Wednesdays that address various topics important to you. And of course, we host our Fitness Fridays, tailoring to Parkinson's disease exercises and getting creative in what you can do at home. If you'd like to learn more about this PD Health at Home virtual experience, please visit parkinson.org/PD Health for more information and to register. And as I mentioned earlier, we do have some things coming up next year. We have our educational program to include the Biloxi, Mississippi market. And then, of course, our Moving Day Mobile, Alabama, April 17th, Moving Day Baton Rouge, April 24th, and a New Orleans educational event in April 2021. Please feel free to stay connected with the Parkinsons Foundation. We have so many free resources that I would encourage you to take advantage of, including our webpage, parkinson.org/Gulf Coast. Our helpline is here for you if you need to talk or need some support and or direction on finding a care provider or an expert nearby. That number for our helpline is 1-800-4PD-INFO. We can help, and I just want to end by saying the Parkinsons Foundation is working on behalf of the entire Parkinson's disease community to make sure that those affected by the disease can live their life to the fullest. I would now like to take a few moments to introduce our first expert who will be talking about the importance of movement for people living with Parkinson's disease. Blair Sali is an assistant professor of physical therapy in the DPT program at University of South Alabama. Her DPT degree is from Belmont University, and she is an ABPTS certified neurologic clinical specialist. She is also a Parkinsons Foundation PT faculty scholar. Dr. Sali has experience in both acute, inpatient, and outpatient neurorehabilitation. Thank you so much for joining us today, Blair. I sincerely appreciate you.
Thank you for having me. I'm excited to be here and to be able to share a topic that I feel very passionate about. And that is really why movement is so important for individuals with Parkinson's disease. And so we know that exercise is important, right? Really for everyone, but I think there's specific considerations that make it particularly important when you have a diagnosis of Parkinson's. What we'll look at today are briefly go over some of the general benefits of exercise. Then we'll look at how exercise may be beneficial, particularly for Parkinson's disease. This includes preventing complications, alleviating some symptoms, and possible neuroprotection. We'll also describe some practical considerations for implementing an exercise program. So before we get started, what really is exercise? Well, the President's Council on Physical Fitness and Sports defined exercise as a subcategory of physical activity. It includes activities that are planned, structured, repetitive, and purposeful. And it's intended to improve one or more components of physical fitness. Before we get started, take a moment to think about how often you exercise per week. You should be able to answer this question on your screen. I'll give you a few minutes to answer, or a few seconds to answer. Okay, great. It looks like we have a mix. It looks like most folks are in the 5 to 7 days per week or 3 to 4 days per week, but we also have several that are still that are not consistently exercising, and that's pretty typical. Hopefully, as we go through this presentation, it will be inspiration to continue your exercise program or to have some considerations for how you may want to modify it to make it a best fit for you. So if you think about how times change, really, if we look back even 19 years ago in 2001, there were only 11 randomized controlled trials, which is kind of our gold standard for research, over the previous 18 years with only 280 people involved. By the time we moved to 2007, we see 33 randomized controlled trials with 1,518 people. This is really good news. It shows that there is more research and really means more evidence and more understanding of what role exercise it has. If you look on the right side of the screen, you'll see a little graphic that shows an increase between 1952 and 2021. This was actually taken from PubMed, which is a search engine showing many research articles, and shows the growth in the number of articles related to Parkinson's disease and exercise. The good news is we're continuing to gain more information, and we'll hopefully be able to have better answers about the role of exercise in Parkinson's disease. What we do know so far is that exercise is important in reducing disability and improving function. Exercise is safe and well tolerated for individuals with a diagnosis of Parkinson's disease. It does provide the same health benefits as it does for the general population, but it may be of additional value in preventing complications, alleviating some symptoms, and providing possible neuroprotection. We'll look at each of these individually. As far as preventing complications, we know that exercise is important for overall health and well-being. For individuals with Parkinson's disease, research shows that they're about a third less active overall compared to healthy older adults. They walked fewer medium and longer walking bouts than healthy controls. What this really means is that we tend to sit longer and not get up to walk as frequently. So we'll have to actively combat that when we look at how to increase mobility. Some of the potential benefits of exercise is improved cognitive function, arrest of osteoporosis, prevention of cardiovascular events, prevention of depression, improved sleep, decreased constipation, decreased fatigue, and improved motor performance. So if we think about some of the symptoms of Parkinson's disease, we know that exercise may help make them better. Some of the ones that we haven't already discussed are things like strength and muscle power, mobility, endurance, walking ability, balance, flexibility. We've mentioned motor symptoms, things like dual tasking, depression, fatigue, sleep, and quality of life. And there are certainly others. But what you should see is that there are a lot of multifaceted benefits that exercise has. Our third main category is looking at possible neuroprotection. This is a really exciting area of research and is continuing to grow rapidly. In animal studies, we've shown that exercise may be able to change your brain. It showed with animals with induced Parkinsonisms, they show improved motor symptoms, enhanced dopamine transmission, so improved dopamine transmission, potential elevation in neurotrophic factors that protect against dopamine depletion and cell loss, and synaptic reorganization and enhanced stability of newly formed connections in the motor cortex with skill training. What that's really saying is that it shows changes within the brain that improve performance. But we need more studies. So we know that there's some evidence within the animal models, but what about in humans? Well, Petzinger did a study looking at experience-dependent neuroplasticity. And whenever you see neuroplasticity, it's really looking at your brain's ability to change its structure. What they found was that exercise, so aerobic exercise and motor skill task practice specifically, made changes at the synaptic level with neurotransmitters, receptors, and dendritic spines, as well as overall brain health. Together, they positively influence circuitry through the basal ganglia, cortex, thalamus, cerebellum, and brainstem to influence behavior, resulting in improved outcomes. Big picture-wise, it can influence overall brain health, which is really exciting. And we ended up with synaptic changes that resulted in faster and more efficient circuitry, which then led to changes in motor behavior. So how do we get started? It's always a good idea to start talking with your doctor. Tell them what you want to do and see if they may have some ideas for where you can go. Physical therapy or reaching out to another rehabilitation specialist that works with individuals with Parkinson's disease is also helpful. These individuals can help you establish an individualized program for gait, balance, mobility, strength, endurance, and range of motion, particularly if you're having current troubles. And thirdly, think of activities that you enjoy. exercise and increased physical activity is something that's not going to be for 4 weeks or 6 weeks. It's going to be a lifestyle change. You don't want to do things that you don't enjoy. Maybe you hate stationary cycling, but you love to dance. That can be something that you can use to help you figure out what's the best plan for you to increase your activity. When I look at a well-balanced exercise program, I always like to consider these 5 kind of bucket areas. The first one is cardiovascular and physical activity. I mentioned previously that some of the potential neuroprotective benefits are actually coming from the aerobic exercise. So I like all of the patients that I work with to be on some type of cardiovascular physical activity program. I also want everyone to be on a strength training program. This will help you be able to move better and maintain function longer. We can add in task-specific training or movement strategy training if there are specific areas where you may be having difficulty. For example, gait or getting up and down from a chair. Balance and neuromotor training is an important component as well. And then we add in stretching and flexibility. We'll look at each of these individually and see how we might be able to add these pieces together into your program. So this slide just shows some examples of what might constitute that exercise category. So if we look at the cardiovascular category, we can reach that goal with anything really that causes an increase in heart rate and effort over time. So things like treadmills, overground walking, biking, swimming, dancing, boxing are just a few options, but there's many other ways that we can also increase aerobic activity. Our task-specific training, movement strategy training, already mentioned walking and transfer training, but that can also include things like dual tasking or cueing, for individuals that may have trouble with freezing of gait or other specific components. Strength training can be done in a wide variety of ways. We can use weight training machines, we can use dumbbells, TheraBand, weighted vest, or body weight. The goal here is to make it challenging for your muscles. With balance and neuromotor training, we can do specific balance training exercises. A lot of times these are good ones to, work with your rehab specialist on to see which ones are the right ones for you. Other classes such as Tai Chi class or dancing has also been shown to positively influence balance. And finally, we have stretching. So these are flexibility and range of motion exercises. Many times with Parkinson's disease, we have changes where certain muscles tend to get tight. And so we want to make sure that we prevent, hopefully, them from getting tight. And also, if they are tight, help try and increase the range available at that individual joint. When we look at cardiorespiratory exercise, or that aerobic exercise component, one of the ways that I teach my patients to know if they're in the right area, or if they're doing the right thing, is to use a standardized scale, such as the Borg rating of perceived exertion, or an RPE scale. This scale on your screen goes from 6 to 20. There is another version that goes from 1 to 10. But really what I want you to do is look at this somewhat hard stage. So on the 6 to 20 scale, that's at number 13. You want to exercise at that level for ideally, we'll get in a minute, but ideally about 30 minutes a day for 5 days a week. But sometimes it's hard to know what is somewhat hard, what is light, what is hard. My general rule is if you can talk during your exercise but not sing would be a good way to kind of double check. So if it's so easy that you could sing a song and not have a problem, then you need to increase your effort a little bit. If you're huffing and puffing and it's hard to talk, you might want to lighten it up a little bit. And that's kind of a good practical way to know if you're at the right level for your exercise program. For our resistance exercises, the main key here is to try and strengthen particularly our muscles, what we call extensor muscles, or enhancing postural extension. I showed this picture on the right side of your screen, and you see this individual standing with a nice upright posture. As you know, with Parkinson's, we have a tendency to come forward. Our shoulders come forward, our hips bend, our knees bend. And as those muscles that would hold you back, they tend to get weak. So we want to look at things like strengthening our shoulder retractors. So these are things that bring our shoulder back, our hip extensors, Our hip abductors, those are the muscles that bring your legs out to the side. Our knee extensors, those that straighten out our knee. Gastroc soleus are our calf muscles that help us go up on our toes. And our trunk extensors, again, bringing that body back. So we spend a lot of time focusing on these in our strength training programs. Kind of going hand in hand with that is the flexibility and range of motion. Whereas when you're coming forward, the muscles on the back tend to be weak. The muscles on the front tend to be tight. So this is an opportunity to stretch those muscles. So we want to open up the chest, bring those shoulders back, bring that posture upright, stretch those hips into extension, okay? So here are some options for how you might, some muscles that may need to be, stretched, and we can look at those a little bit more closely later. We can also look at balance. Like I mentioned earlier, you can have an individualized program. And I would recommend if you're having falls or you're having a lot of problem with balance and you have not seen a PT for that, I would recommend reaching out to see if there might be something they could specifically do. But other options are dance, Tai Chi, yoga, and many others. The key we know to balance training is it has to be challenging. So it has to be something that you can do, but that is difficult. Key here is, though, we have to be safe, and you must take precautions to prevent a fall. You wouldn't want to do balance training out in the middle of the room, for example, because if you happen to lose your balance, you wouldn't be able to prevent a fall. That's why I recommend if you're just getting started, this is a good one to reach out for some help on. And then we have the other consideration of what do we do outside of our structured exercise time? So I exercise, but what do I do the rest of the time? Well, it's important to lead an active lifestyle. In a general rule, for every hour you sit, you want to walk at least 5 to 10 minutes. So maybe it's setting a timer to say, oh, I've been sitting for 60 minutes, now I need to get up and walk. Some examples of activities you can do to increase your activity level would be things like gardening, cooking, yoga, Tai Chi. I skipped household chores. Some folks say they don't want to do that one. Aquatics, swimming, walking, or really any other activity that gets you up and moving. And we'll actually do a little bit of activity here in a minute from where you've been sitting during this presentation. So how do I start putting together my individual exercise program? Well, the American College of Sports Medicine gives us some guidelines for how to break up these different kind of categories. And to me, I look at these as building blocks for your week. So if you have 7 days, you have some flexibility of how you put these together. In general, for cardiorespiratory exercise, they recommend 150 minutes of moderate intensity per week. Well, what that really works out is to about 30 minutes, 5 days a week. If that seems completely undoable at this point, I've had a lot of patients start maybe even with just 5 minutes a day, and then have a goal to increase a little bit each week as they're able to try and work towards an ultimate goal of increasing overall cardiorespiratory exercise. The second category of resistance exercise, we usually say that 2 to 3 days per week, and I recommend spreading them out. So maybe Monday, Wednesday, Friday, or at least so you have a day in between. Our general goal for resistance exercise, to know that you're doing it in a manner that will help with strength, is to be able to do 2 sets of 8 to 12 repetitions. You'll know it's the right weight or the right challenge is if you get to that 10th or 12th repetition and it's somewhat hard. Our flexibility exercises are also 2 to 3 days per week. So you don't have to do them every day, but you do want to spread them out through your week block. Their recommendation is to hold for 30 seconds. I always tell folks to try and hold for at least 45 seconds because I don't know about you, but when it hurts, I tend to count fast. And that way I know I've at least met that 30-second goal. We do know that the longer we hold, the better stretch we get. You should hold each exercise do each exercise 2 to 4 times and perform when your muscles are warm or after exercise. And then your balance or neuromotor exercises, you should do 2 to 3 days per week for approximately 30 minutes. Some of our special considerations, as mentioned earlier, are fall precautions. You don't want to do anything that puts you at risk of a fall. If you're unsure, ask. Monitor blood pressure. And do not perform any exercises that you feel are unsafe or increase pain. You should check with your PT or medical doctor to see what recommendations they have. Many times they can help modify and adjust your exercise program to improve safety and comfort. Sometimes it's a small change just to do the exercise in a little bit different way. I do want you to know this is your program. Like I said, it's a lifestyle change. It's something that should work for you in your lifestyle. It should be based on your individual goals. You can consult with a physical therapist, MD, or other rehabilitation professional with experience working with individuals that have Parkinson's disease. You should also consider seeking support from friends, family, and others, and find activities that you find enjoyable. Again, it doesn't really matter what I would like to do. It matters what works for you, and make it part of your daily routine. If I told you that you had to exercise at some point tomorrow, it's really easy to get caught up in other things. But if you make it part of your daily routine, that every day after lunch I take a walk, or every day after my favorite show I go through and do my strength exercises, then you don't have to think about it. It's just what you do, and it makes it much more likely that you'll be successful within your program. So this is all well and good. But the biggest thing you need to do is think about what will you do next week, or what will you do tomorrow? Make a plan. If you go ahead and make a plan, even one small thing, it at least helps you start moving in the right direction to increase activity. Go ahead and write it down now and hold yourself accountable. If you're worried, have somebody to help be a support group as well. What I want you to really think about is that exercise is a vital part of the treatment of Parkinson's disease. It's not a nice to have, it's a need to have. You should start early and stick with it. Like I said, it's not a 4-week program or a 6-week program or an 8-week program. It should really be a lifestyle change. You want to find what works for you. Find things that you enjoy and that can be successful in your day-to-day life. Thank you for your time. All right. Now we're going to move, since you've been sitting for a little bit, I'm going to move over here, and we're going to do just a little bit of movement. And these are going to be, hopefully you can hear me from here. Danielle, can you hear me, or Krista?
Yep, we can hear and see you just fine.
Perfect. All right. So while you're sitting in your chair, we're just going to do a few things to get your body moving a little bit. Okay. So the first thing I want you to talk about is just with posture. So if we're going to do exercises, go ahead and try and sit up as straight as you can. I like to think about a string through the top of my head, pulling straight up. You'll know you're doing it right because your whole body will come up, but you won't see your chin tipping up or down. This is going to be our position that we're going to try and work in, okay? We're also going to talk about breathing. As you breathe, try and breathe in through your nose and out through your mouth. You want good deep breaths that help expand your chest. So breathe in and blow out through your mouth. Okay, so keep doing, we're going to work on breathing as we go through here. If you need a break, stop and breathe. Okay, so just to get kind of loosened up a little bit, I want to start just with your neck. Kind of turn your head slowly side to side. Again, kind of stay in a range. You don't want any pain with this, but you do want it to kind of move a little bit. Okay, so slowly side to side. Okay, we're also going to go kind of ear to shoulder. So ear to shoulder one way, ear to shoulder the other. Okay, again, it should not cause pain. It may be a little stiff. Next, I want to do some shoulder circles. Okay, so I'm going to do with my arms out to the side. If you can, we're going to do backward shoulder circles. So again, going backwards actually helps those postural extensors a little bit more. Okay, if you can't get your arms out to the side, you can do it just with your shoulders at the side. Okay, so we're going to do 10 of those. So 1, 2, 3, make those nice and big. 4, reach up high. 5, you should feel it stretch across your chest as well. 6, 7, 8, 9, 10. Good. And like I said, by going backwards, I'm really trying to kind of help use some of that postural extension. You may even feel some stretching across the chest as you go back. Next, I want you to, if you can, I want you to try and reach both hands up above your head. Okay, I have my hands together because that works best for me. If you can't get both hands up, you can put one hand on your waist and the other hand straight. If that doesn't work at all, you can just do hands on the waist. But what we're going to do is try and bend to the side. So if you can see here, I'm making like a half moon. So I'm going to kind of go this way and then back up to the middle. And now I'm going to the right. Okay, back up to the middle. So it's still nice and tall, but just trying to let that lateral chest kind of stretch a little bit. Okay. And usually I find this one feels pretty good once you're done. Okay. If you can't do both hands, you can do one hand and then the other. Okay. Next one I'm going to do is a cross reach. So I'm going to take my right arm and kind of reach to my left side. And then I'm going to come back to the middle and take my left arm and reach to the right side. Okay. So it's a rotation through the trunk. Again, as best you can, sit up nice and tall. Take some deep breaths and reach, reach. Okay. 2, 3, 4, 5, 6, and go ahead and do these along with me. 7, 8, 9, and if you notice, I'm going straight out to the side. 10, or I'm trying to get that rotation through my trunk. Good. So all these exercises really are more in that mobility kind of component of just trying to get things moving. Okay. Next, I'm going to do what as PTs we like to call long arc quads. They're really an opportunity just to work on the muscles on the front of your thigh. So you're going to straighten your knee out and come back down. And then we're going to do, today we're going to do right and then left. You can do one leg at a time, but we're going to do kind of in a marching pattern. So right leg straight, left leg straight. This is really easy, we can add in an extra challenge. So you can actually add a reach. So we could do reach, reach. So this adds a little bit of a balance challenge to sit, okay? And it also helps work your arms just a little bit. Okay, good. So another muscle we said that we want to make sure that we're working a little bit is what are the muscles that bring the legs out to the side. So I'm going to have you bring your leg out and out, okay? So we can just bring one out and back in, and then the other leg out and back in. If you can, I'm going to add an extra challenge on top of that, okay? So as my right leg comes out, I'm going to reach with my right arm overhead and come back in. And then as my left arm goes out, I'm going to reach this way. So if you note, I'm kind of making a diagonal, or it should be a diagonal if you're doing this. This one does challenge sitting balance as well. So if you don't feel safe with the reach, you can make it go not quite as far, or you can just stick with the legs, whatever works best for you, okay? The next one I have is really for the ankles and for the calf muscles, particularly. So here, you may not be able to see my feet, but what I'm going to do is I'm going to bring, kind of go up on my toes. So let me see if I can actually show you just for a second. All right. I wore my blue shoes, so hopefully they can be seen. All right. So for this one, you're going to go up on your toes, come back down and lift your toes up. So it's actually going to work the muscles on both sides of your ankle. Your calf muscles are really important for helping with propulsion during gait. So that means being able to push while you move. It also helps provide some stability during gait, okay? So it's a good one to kind of work from that regard. We know that our calf muscles, they tend to get tight. So this is kind of a little bit of an active stretch as I bring my toes off. It can help stretch that a little bit. And we also know that the calf muscles tend to be weak. So when my heels come up, it helps activate those muscles. All right. Lastly, I like to do a little bit just to get the trunk going. I'm actually going to turn sideways. I'm going to turn it up so you can see me again. Is what I like to call a pelvic rock. If you think about your pelvis, where you sit, is kind of a bowl. We can rock that bowl forward or we can rock that bowl back. What it does, if you notice, I'm trying to put my hands here, you should see that it causes some movement through, particularly my lower back, okay? So it is a good way to kind of get those muscles moving, just to make sure that we're not getting quite so stiff. So practice rocking up and rocking back. It shouldn't be a rock this way. If you notice, my head is staying relatively still, and that movement is actually coming from my pelvis and lower back. And finally, for our last little bit, I wanted to show you a stretch. So hamstrings tend to be tight. Hamstrings are these muscles that are on the back of your thigh. So we can actually stretch these in sitting. If you kind of scoot a little bit to the edge of your chair, you can straighten out your leg, make sure your knee is straight, okay? If you think about that bowl I just talked about being where you sit, kind of rock it up so you're up nice and tall, okay? And then here, you're gonna slide your hands forward, and as you come forward, you should be able to feel a stretch on the back of your leg. Your left leg should be on the ground in front of you a little bit. It's gonna provide your stability so you don't topple forward, okay? So you notice I have this one kind of balancing me as I lean forward, and actually I have pretty tight hamstrings. So that's enough of a stretch for me. We would hold this one for at least 30 seconds. So let's try it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I always think it's the longest 30 seconds ever, right? I'm going to bring my feet back. I want to do the other leg because I always want to be equal. So we'll end on this one because I think we're about out of time. But again, keep that left leg straight. Have that right leg in a good solid position, and then lean forward. You will know you're doing it correctly because you'll feel that stretch on the back of your thigh. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. That's it. Thank you. Hopefully it helped a little bit to get moving in the middle of our presentation. I enjoyed speaking with you today.
Danielle, can you hear me?
You sound great.
Okay, perfect. Thanks so much, Blair. I sincerely appreciate it. It was a lot of fun to go through those exercises myself. And I think those are perfect movements that we certainly can do from home, as we were just all were. So thank you so much for your time. I'd like to now introduce our next speaker, Annie Wallace. Annie is the Associate Director of Education at the Parkinsons Foundation. She completed her Master of Social Work focused in Community and Social Justice from the Ohio State University and her Bachelor of Social Work from Florida State University. Annie's primary focus is providing quality informational programs and resources for people with Parkinson's disease, their care partners and loved ones, and the professionals who are part of the medical and care team. Annie is charged with managing the production and distribution of educational materials in English and Spanish, designing the International and Bilingual Care Partner Summit, and growing the Parkinsons Foundation Aware and Care Hospitalization initiative to help people with Parkinson's disease get the best care possible during a hospital stay. It's my pleasure to introduce Annie Wallace.
Hello, everyone. Can you hear me? I hope that's a yes.
Yes, we
Okay,
hear you.
I'm going to share. Okay, great. All right, I'm sharing my screen. I hope you can see it. I am so excited to talk to you all today. As Krista mentioned, I got to spend a good amount of my time doing my undergrad in Tallahassee, and I've actually got close family in the Pensacola area and in Thibodaux in Louisiana. So it's an honor to be part of this program for the Gulf Coast chapter. So before we get started, I wanted to just get a sense of how many of you have experienced a hospitalization since you received your Parkinson's diagnosis. So the options are whether you have experienced a planned or an expected hospitalization, whether you have had an emergency hospitalization, if you've had both a planned and an emergency. So if you've been in there for, like a DBS surgery would be the example of a planned, or no, you haven't had a hospitalization. Okay, all right, so I'm thrilled to see that a lot of you have not had a hospitalization at this point, but still a decent chunk who have had either, planned or unplanned hospitalizations. So the reality is that the hospital is not always the best place for people with Parkinson's. Most of the time when you're headed into the hospital, you assume that they will know how to take care of you. You might assume, oh, they'll definitely know that they should call my neurologist. They'll understand my symptoms and have all of my Parkinson's medications. They'll bring me my medications on the same timeline that I take them at home, and they'll know what medications are unsafe for me. But the unfortunate reality is that a lot of times in a lot of hospitals, these are not the case. And so I hope that this presentation will help you all understand what you can do for yourselves or for your loved ones with Parkinson's, or for any clinicians who are joining for your clients or patients with Parkinson's, to help make sure that they are prepared to advocate for themselves and educate any clinicians who don't fully understand Parkinson's and how to provide the best quality of care. So compared to folks without Parkinson's, people with Parkinson's are hospitalized much more than their peers without Parkinson's. They stay in the hospital longer, they suffer avoidable complications at a higher rate, and they're less likely to be sent home. Over 60% of people with Parkinson's are discharged into a facility, whether that's a rehab facility or an assisted living. And so we want to make sure that you have everything you need so that if you have to go to the hospital, you leave in better shape than when you entered. So I want to talk a little bit about the scope of this problem. I want you to think of 12 people with Parkinson's. I would bet that many of you know 12 people with Parkinson's, especially if you're part of an exercise class or a support group. So of those 12 people with Parkinson's in an average year, 4 of them will be hospitalized. Of those 4, 3 of them won't get the right medication on time every time. And when that happens, of those 3, 2 of them will have complications directly as a result of the mismanagement of their medication. So what we know is that in a given year, 2 out of every 12, or 1 in every 6 people with Parkinson's will have avoidable complications because the hospital just doesn't know and understand their needs. The reality is the medications you take to manage your Parkinson's disease are as necessary to you as insulin is to a diabetic. But unfortunately, Parkinson's is often a paragraph or a chapter in a textbook for nurses, for doctors, even for pharmacists. And they just aren't well educated around what you need and how important that medication is. And some of the things that they don't know about how they can mess up your medications are fit into one of these 4 categories. We talk about MODS. Missed medications. This is when they miss your medication entirely by error. So this might be if you go into the hospital with a heart attack, they may not even realize that you have Parkinson's. So of course, they're not going to know to give you your Parkinson's medication. They can also be omitted, which is when they're held intentionally. When a clinician incorrectly assumes that you shouldn't be getting it, a lot of times this is before surgery when you're NPO or nothing by mouth. They really should still be giving you your medication, even with just a sip of water. Or if you're having severe swallowing issues, they think, oh, they can't swallow their pills, they shouldn't take their medication, when really they need to find a way to get it to you because you're swallowing and all of your symptoms are only going to get worse without your medication. We also will often see that medications are delayed or they're not distributed exactly how you take them at home. There's really two issues that fall into this bucket. So nurses in 99% of hospitals, their policy is to distribute medication within an hour before or an hour after the prescribed time. And that's the reality because we ask nurses to manage a lot of patients at once. They have a lot of other things on their plate and it's just more efficient. But that does not work with Parkinson's. If you take your medication at 10 a.m. and they bring it to you at 11, there's a decent chance that you're going to really suffer. And truly, the same is true even if they come an hour early. And the other issue is that a lot of times when they put your medication schedule into the electronic medical record, instead of putting that you take it at 10 a.m. and at noon and at 3 p.m. and at 7 p.m., they may just put it in as 4 times a day. And then they don't even pay attention to when you're supposed to take it. They just give it at the standard 4 times a day, which might be, 6 a.m. and 11 a.m. and 3 p.m. and 8 p.m. I mean, it could be totally different than your usual schedule. And the other big issue is substitution. So this is when they give you anything other than the exact medication that you typically take, even if it's changing immediate release for continuous, or even just swapping a name brand and a generic can cause problems for some people with Parkinson's. So as you can imagine, it's any number of these things can go wrong and it can lead to some really bad outcomes. So whether it's a planned admission or an emergency admission, seemingly minor errors by anyone providing care can mean a crisis for a person with Parkinson's entering the hospital. Why is this happening? So we talked a little bit about this. There's really a lack of awareness of how critically important Parkinson's medication timing is. Many don't understand that poorly managed Parkinson's can result in mental confusion and other serious symptoms. And there's a lack of awareness that many common medications for pain, nausea, depression, and psychosis are unsafe for people with Parkinson's. I want to emphasize that part for you because a lot of times we see that people with Parkinson's who don't get their meds on time will have some confusion, some disorientation because they didn't get their meds. And then the hospital staff, not knowing any better, will then prescribe them an antipsychotic to try and address the mental confusion that was caused by the missed medication that is going to just make the situation worse. This happens in the best hospitals. This happens even when our people with Parkinson's are treated at our centers of excellence, unless we intervene. So what's the solution? Don't worry, I'm not leaving you all with just terrible news. Every care provider needs to prioritize the involvement of the primary Parkinson's care provider. So they need to be checking in with your neurologist or your movement disorder specialist, whoever is your go-to doctor or nurse practitioner or physician assistant treating your Parkinson's. They need to be looped in. They need to value the knowledge that the person with Parkinson's and the family care partner provides. You all are the experts in your experience with Parkinson's and your treatment of Parkinson's. And they need to understand and utilize the recommendations within the Aware and Care materials, which we're going to talk about in a minute. So remember, every person with Parkinson's has a unique combination of medications and the regimen in which they take those medications. A person with Parkinson's has the best knowledge of their disease and any other conditions they have, but in the hospital, they may have some communication challenges, maybe some that are new, that aren't an issue when their Parkinson's meds are functioning well and when they aren't, dealing with whatever that issue is that brought them to the hospital. So care partners can have all of that information and can advocate for the person with Parkinson's. And the Aware and Care materials should really be used from admission through discharge to ensure that best practices are followed. So there are 3 ways to access this free information that I'm going to walk you through quickly so I don't take up too much time before we get to the next presenter. But all of this can be accessed at parkinson.org/awareandcare. You can download and print materials. You can order the free Aware and Care packet, which comes at no shipping charge without some of the more bulky items within the Aware and Care kit, which is available online with an $8 shipping charge. So a little bit about the key materials. The fact sheet for nurses is a great way to share vital information about Parkinson's disease with every member of your care team. This is available online to print. It comes in the packet. It comes in the full kit. The medical alert card is another key piece. You want to fill this in with your emergency contact information and keep it in your wallet. And then the other key piece is the medication form. You want to complete this and keep copies in your kit for use in the hospital. And if you download the form at parkinson.org/awareandcare, you can type directly onto it and print it out so you don't have to worry about your not so easy to read handwriting that's so common with Parkinson's disease. And then we've got some additional materials. These are available to print, or they come in the full kit but don't come in that packet that doesn't have the shipping charge. A little insert about DBS if you use that therapy, and another on Duopa. And then the hospital action plan is a booklet that really walks you through everything you need to know about using these materials ahead of a hospitalization. We've also got some print-only materials. We've got letters that you can have your doctor sign ahead of a planned surgery. And really, most importantly, I want to make sure you all know about the doctor letter for hospitalization during coronavirus. I want all of you to make a note to send this to your primary Parkinson's doctor, have them sign it, print it out, and have it ready in case you have to go to the hospital. So the kit-only materials, the kit bag, we've got a magnet and a bracelet. And I want to just encourage you, if you don't have the kit bag, we really want you to establish a specific bag to hold all of these materials and keep several days of medication in their original bottles. You should be using this kit, as I've said, when you're in the hospital, but also bring it to your checkup with your Parkinson's doctor. Make sure they know about this and are sharing it with their other patients. Bring it with you when you're traveling. Use it in extreme weather emergencies. Hopefully you won't need any more preparedness for weather emergencies this year, but be ready for next year when it's hurricane season again. And just a little bit more about being extra prepared during coronavirus. You need to have a plan in case your loved one can't be there with you in the hospital. So make sure you've got that hospitalization during coronavirus letter signed. Make sure that you ask your local hospital ahead of time what their policies are around letting visitors in during coronavirus. Bring all of your Parkinson's medications in their original bottle because your loved one might not be able to run home and get them for you. Make sure your medication form is updated. And care partners, if you're not able to go into the hospital with your loved one, you can request regular updates through Zoom video calls or FaceTime. Do this immediately upon admission in case your loved one isn't able to communicate it later on in the hospitalization. And I know it's not always fun to think about, but this is a great excuse for you to think about preparing your advance directives. Establish who's allowed to make decisions for you if you're not able to communicate in the hospital, and establish what you want the clinicians to know about end-of-life decisions. So one last survey, and then I'll turn it back over. I want to know how you all plan to prepare for a potential hospitalization based on what we've just talked about, whether you're going to download the materials and print them, you're going to request that free packet, request the kit for just the $8 shipping fee. You're going to take a look at the materials you already have on hand and update them, or if any of you are clinicians watching, encourage your patients or your clients to do one of the above to be prepared. Let's see how we did. Oh, I love that many of you already have these materials. Well, I can't encourage you enough to take a look at your medication form, make sure that what you have written down is accurate and up to date. Make sure you get your doctor to sign that hospitalization during coronavirus letter, and put your kit in a safe place where you know how to grab it in an emergency. So that you know, we have Aware and Care ambassadors who are volunteers spread across the country who are available to come and speak virtually for now to any support groups or to groups of clinicians who want to learn more about this. And I'm so grateful that you guys made time to listen to this. I hope that you never need to know this information, but I hope that if you do need it, you have it and you're prepared to advocate for it yourself or your loved one. Thanks so much.
Thank you, Annie. Sincerely, I know how important that Aware and Care Kit is to so many people with Parkinson's and their caregivers and just their overall experience in the hospital, whether it's planned or not. So I'm also just very passionate about the initiative that you're charged with across the nation. So thank you so much for taking the time to share these resources and materials with our Parkinson's community across the Gulf Coast. Thank you so much. And now it is my sincere pleasure to introduce our next speaker. Dr. Calegan is one of the Gulf Coast region's most well-known and respected movement disorder neurologists. He is a South Louisiana native who graduated valedictorian from Woodlawn High School in Baton Rouge and magna cum laude from Louisiana State University with a degree in petroleum engineering. Dr. Calegan earned his medical degree from the Tulane University in New Orleans with honors, and he completed both his neurology residency and movement disorder fellowship at the University of Alabama Birmingham Medical Center. Dr. Calegan joined the Neuromedical Center in Baton Rouge in 2006 and is one of the 3 movement disorder specialists on staff. He currently coordinates care for over 1,000 patients with Parkinson's disease. Additionally, Dr. Calegan is the co-founder of Baton Rouge's first and only deep brain stimulation program and has successfully performed over 400 DBS surgeries to date. Many of you may recognize Dr. Calegan from viral videos on Facebook or YouTube that capture the remarkable transformations of patients with Parkinson's after DBS surgery. Alongside with state-of-the-art neurologic care, Dr. Calegan emphasizes what he calls the 4 pillars of health: diet, nutrition, exercise, and sleep. We will all get a taste of his unique approach to treating neurologic disease today. Dr. Calegan, thank you so much for being here.
Thanks, Krista, for having me and for organizing this virtual event. Thanks to the previous presenters for their great presentation. So I guess we'll get started now. Do I click share screen? Okay, let me get this done. Sorry, y'all. Let me do one quick thing here. Let's get the slideshow going. What button do I press?
You want to press play at the top right-hand corner.
Okay, it was blocked by the video stuff. Okay, here we go. Sorry about that. All right, thank y'all for having me. So I'm going to talk today about not only surviving, but thriving with COVID and Parkinson's disease. And here we go. Let's get to the next slide. So all the things I'm about to say, not really meant to be medical advice for you specifically, even though I am a physician. Please consult your physician before making any changes to your diet or exercise routine, because of course, I don't know all of your medical issues, and every single thing I say might not be safe for every person based on their individual medical issues. But I think in general, the best way to thrive with COVID and Parkinson's is to have a healthy lifestyle. You know, we don't have a cure for COVID. We don't even have really good treatments yet. So the best bet is prevention, and prevention means optimizing your immune system, and you do that through a healthy lifestyle. And by the way, I've been preaching this for 10 years or more, and it's really the same thing I say in the absence of COVID and in the absence of Parkinson's. It's just that much more important if you have Parkinson's, and especially if you're older and there's a risk of getting COVID. Parkinson's disease itself, I don't think is an independent risk factor for COVID. The main COVID risk factors are listed here below. It's mainly, age, especially over the age of 70. But it's not like all of a sudden age 70, your risk goes up astronomically. It's a gradual increase in risk that does sort of take off after age 70, a little bit higher. So, or I mean, quite a bit higher after age 70. But really, the reason age is a risk factor is because of insulin resistance and diabetes. So I think that's the major reason age is a risk factor. So even young people with diabetes have a, similar risk as older people, I think. And then these other risk factors you see here, if you have a compromised immune function or major organ disease and obesity, those are all risk factors as well. So I'm going to talk today about what I call the 4 pillars of health, which are the foundation of health: diet, sleep, exercise, and stress reduction. So we're going to dive into each one of these a little bit here today. First, we're going to talk about diet. So the problem with diet is that we don't have definitive scientific evidence to say what diet or what foods are good for people and which ones are bad. That's why you hear so many different things on the internet and on TV. Everybody's got a different opinion because the way we have to study diet is with second-rate studies. I call second-rate science, epidemiological studies. Basically what that means is they give people a food questionnaire, ask them what they eat every few years, and then they do this study that claims to know all the answers. Well, the data you get from a food questionnaire is very suspect. It's not like they're analyzing everything you're eating, and you can't remember everything you eat, and you don't eat the same way every day. So, and your diet changes over time. So if they give you a questionnaire every few years, it's not going to be, like representative of exactly what you eat. So therefore, we have to rely on these second-rate studies. We have to rely on animal studies. We're not the same as a rat, so you can probably not be too surprised that sometimes what's good for a rat is not good for a human, or at least ideal. So all the things I'm about to say are really my opinion, and you're going to have other people with different opinions. So take that for what it's worth. But I have done a lot of research on this, and I do think I'm hopefully on the right track here. But in general, I think most people would agree these are very sound advice for people. Mainly avoid sugar and processed food. And it turns out that's usually the same thing. So usually foods that are high in sugar are also processed foods. But any processed food, anything with a label, I think is not ideal. So I promote, eating real food, real meats. So meat, poultry, seafood, and then non-starchy vegetables. So I would limit starchy vegetables like corn and potatoes because they tend to increase your blood sugar quite a bit. That leads to insulin resistance and diabetes. Fruit is healthy, but only at, I think, small amounts. So fruit does have a lot of sugar. So if you eat a big bowl of grapes, for instance, your sugar is going to skyrocket, and that has a lot of secondary, tertiary effects on your body. So again, any food that increases your blood sugar a lot is going to, over time, if you do that a lot day after day, that's going to lead to insulin resistance, obesity, diabetes, and all the bad things that go along with that, which is most major disease. Insulin resistance linked to almost everything bad. That's basically pre-diabetes is insulin resistance. So if you're on that spectrum of having insulin resistance or diabetes, it puts you at risk for about 35 different kinds of cancer, obesity, hypertension, dementia, kidney disease, heart disease, strokes, heart attacks, almost basically all the leading causes of death and disability. Even increased risk of Parkinson's. That's fairly recently discovered. Moving on, a lot of people are dairy sensitive. So, and a lot of people don't even know that they're dairy sensitive. They don't think they have any side effects related to it. But if you don't have ideal health, really, I would say everybody should try to give up dairy 100% for 1 month to see how they feel. And that's not easy to do, by the way. That means giving up everything that has butter in it or milk. So a lot of things are made with that, of course. So that's hard to do. But I think everybody should do it for 1 month just to see how you do. You might be surprised. A lot of your allergies is dairy sensitivity or grain sensitivity, and that causes a lot of congestion. If you have congestion year round, it's probably not seasonal allergies. It's probably something you're eating. So dairy is one thing you might want to consider giving up if you're not just super healthy. And the other thing is grains. So anything made with wheat, has gluten in it, and gluten is very inflammatory to the body. It spikes your blood sugar, leads to leaky gut, immune system dysfunction. Another bad thing about foods made with wheat is that in this country, wheat fields are sprayed with Roundup right before they harvest. That chemical is strongly linked to cancer and Parkinson's, and it's banned in many countries, but for some reason allowed here. So that's why I recommend avoiding wheat or gluten as much as possible. Okay. All right, moving on to sleep. So I said before that, the science on diet is really uncertain, but everything else I'm going to talk about from now on, sleep, exercise, and stress reduction, those are very soundly based and very good in numerous clinical trials. So from now on, everything I say is considered to be true by probably almost every, Parkinson's expert. So sleep is extremely important for everybody, but especially, if you have a chronic disease like Parkinson's. So poor sleep leads to anxiety, depression, increased risk of dementia. We learned that recently because we learned that when you're in a deep stage of sleep, that's when your brain sort of has these waves that clears out these trash proteins that accumulate in our cells in our brain. And that's when those trash proteins are cleared out. So if you don't get a lot of deep sleep, the trash doesn't get cleared, it builds up, gunks up the brain, and that's linked to dementia in animal models and also preliminary data in humans as well. Poor immune system function. So even a single night of poor sleep. So if you get just a single night of 4 hours of sleep, that's been shown to cause a 70% reduction in natural killer cells, which are very important in fighting infections. So literally, if you don't want to get a severe COVID infection, one very easy thing to do is just try to get a very good sleep every night. 7 to 8 hours of actual sleep. I think I'll talk more about that in a subsequent slide. Poor sleep causes a lot of other problems too, reduced sex hormones, increased risk of diabetes. It increases your risk of obesity because when you don't sleep well, your hormones get screwed up. There's many hormones that regulate appetite and satiety. Leptin and ghrelin are two of the big ones, and they regulate, how hungry you are and how full you are. And both of those are screwed up when you don't have good quality sleep, and studies show you do eat more. Poor sleep, causes you to be drowsy driving, and poor sleep strongly linked to car accidents. That's a very quick way to accumulate a lot of disability if you get in a bad car accident. So a lot of reasons to get a good night's sleep. When I did a lot of sleep research, I realized, in nature, sleep is something that every animal on the planet does, even down to insects, really even down to bacteria if you get into the nitty gritty. And if you think about it, it doesn't make sense that all animals would sleep, because when they're sleeping, they can't defend themselves, they can't gather food, they can't mate, they can't raise their offspring. So seems like it'd be a disadvantage to sleep 1/3 of your life, but still every species does it. So that's how important it is. So despite a lot of disadvantages, nature has preserved sleep in all species. And so that's super important. Okay. So some advice on sleep, some other caveats. I I don't really like to prescribe sleeping pills. I mean, of course I do in some people, and there's other reasons to give quote unquote sleeping medicine, besides insomnia. But when it's just used for insomnia, I think that's a lot of times not a great idea because sleeping pills, most prescription sleeping pills are linked to dementia, confusion, hallucinations, and cancer. So things that I think we all worry about as we get older. And moreover, these sleeping pills have not really been shown to improve sleep quality. I mean, they do help you fall asleep. I mean, they help render you unconscious, but that doesn't mean you get better sleep because restful, good quality sleep is what is restful sleep and makes you feel better the next day. But if you're already on a sleeping pill, I don't advise you just abruptly stop it. Please consult with your doctor first. Again, sometimes these pills are used for other things, especially in Parkinson's. And if you withdraw suddenly, if you stop suddenly, that can cause some withdrawal type symptoms. So just be careful and talk to your doctor about it if you're already on a sleeping medicine. So here's my tips. The big tips for sleep is to practice good sleep hygiene habits. And you can look this up on the internet, but basically it means we try to get 7 or 8 hours of actual sleep every night, not 7 to 8 hours in bed, 7 to 8 hours of sleep. So you have to add the time that it takes you to fall asleep, and you have to add all the time that you spend getting up in the middle of the night to go to the bathroom and falling back asleep. So that means you probably need to be in bed 9 hours to get 7 or 8 hours. So plan for that. Plan to be in bed 9 hours or even more if you have trouble falling asleep or you wake up a lot. Have a good routine. We are creatures of habit. Our body likes routine. And so let's give it a good bedtime routine. Same time to bed, same time to wake up. Yes, even on weekends if you can swing that. And before you go to bed, very important, I think, to wind down in the darkness, not pitch black necessarily, but turn the lights down, stop watching TV. Good time to do some meditation, actually. But just have a routine, or maybe drink some chamomile tea or some non-caffeinated warm tea to help you go to bed. Bedroom conditions are important. Bedroom needs to be quiet, dark, and cold. That helps you sleep. Actually, 66 or 67 degrees has been shown scientifically to be the ideal temperature of the bedroom. I know it's kind of cold, but it's ideal. Before we had civilization, we slept in the wild, and it gets cold at night, right? So we've learned to sleep in colder weather at night. If you think about it, it makes a lot of sense. You should avoid eating in bed or watching TV in bed, because that trains your brain that the bed is for entertainment, hanging out. But you don't want to give your brain that message. You want to give your brain the message that that the bed is for sleep and sex only. Okay. And if you're in bed and you have trouble falling asleep, it's recommended that you get up out of bed, go do something else in another room, not the bedroom, because again, the bedroom's only for sleep and sex. So go to another room, maybe read a magazine article or a book. I wouldn't watch TV because the bright light can mess with your sleep, but go in another room, do something till you get tired, then you go back to bed. That's the recommendation. Also, minimize caffeine. I find this is something almost everybody does. They drink way too much caffeine. And as you get older, you don't metabolize caffeine the way you did when you were young. So just because you could drink a cup of coffee in the afternoon or in the evening when you were younger doesn't mean you can do it as you get older. Caffeine has a half-life different in people, but most people it's about 6 or 7 hours. So even if you only drink coffee first thing in the morning, 1/4 of that caffeine level is still going to be in your system at bedtime. And then if you drink after that, it's going to be way higher. So I say 1 cup of coffee or tea in the morning only. And if you still have trouble sleeping, cut that out as well. alcohol really disrupts sleep. So no alcohol within 2 or 3 hours of bedtime. Sunlight improves your sleep considerably. So make sure you get 15, 20 minutes of sunlight directly without sunglasses, okay? The light from the sun hitting your eyes stimulates hormones. Over 20 hormones regulate your circadian rhythm, and they're regulated by sunlight. And if you don't give your body the stimulation that it needs naturally, it's just not going to be there. Exercise too. Exercise stimulates these hormones that help us sleep. Back before, back in the caveman days, we exercised every day. And so that's what our body thinks we need to, in a normal day, to get to sleep. Already talked about if you are lying in bed and can't sleep, get up and go do something else until you get sleepy, then go back to bed. And then these new weighted blankets are very helpful for a lot of people to sleep. So if you have a lot of trouble sleeping, think about getting one of those weighted blankets. Let's switch gears to exercise, the third of the 4 pillars. So there's no one magic exercise for Parkinson's. Some are probably better than others, but really almost every type of exercise that's been studied in Parkinson's has been shown to be helpful. For many years, there was a lot of data on riding a bike, and people, and it is a great exercise, and I love for people to do that, but you have to understand they studied that because it was easy to study. You could put sensors on a stationary bicycle and monitor everything on a person, their respiratory rate, their heart rate, if they're sweating, if they're having EKG changes, how much calories they're putting out. So because it's easy and cheap to study, that's what they studied. But really any type of exercise is great for Parkinson's. And also studies clearly show the more you exercise, the better the benefit. But be sure to consult your doctor first. Again, there's a lot of specific things to you that you may need to be careful about if you have, heart disease or lung disease, especially. People with Parkinson's who exercise definitely seem to have slower progression of their disease. They take less medicines, they're happier, they sleep better, they have less disability and less fatigue. It's just all around win-win situation. And you don't need insurance approval for this one or a prior authorization or anything like that. So take advantage of that. And if you don't know what you're doing, get some help. So I advise getting a personal trainer or physical therapist. If you don't know what you're doing, get a plan, make sure you're doing things correctly, make sure you have a good routine, and change the routine from time to time. Don't do the same thing over and over and over, because our body adapts very quickly to what we're doing. And with adaptation, means your body doesn't get the stimulus. It doesn't stimulate the body as much. You want to stimulate your body, and that forces your body to adapt or change or improve in response to the exercise, and that's what you want. Exercise stimulates a chemical in your brain called BDNF, brain-derived neurotropic factor, and that chemical actually makes you grow new brain cells, which slow the loss of neurons from Parkinson's disease, and if there's dementia, it slows dementia, and just general aging process in general, it slows that down. I recommend 3 major types of exercise. 2 of these types are here. So cardiovascular exercise is the first thing I recommend, and I recommend ideally 2 different types of cardiovascular exercise. Something where you do something slow for a long time, like walking. You can build your way up to 30, 40 minutes at a time, up to several days a week. And ideally, you would alternate these days of long, slow exercise with days of high intensity exercises. Something where you break a sweat, something where you go, as hard and as fast as you can for 30 seconds or 60 seconds, and then take a break and then do it again. And it's called high intensity interval training. Extremely high yield exercise, completely different benefits than just walking. So you want to get both of those different kinds of benefit, ideally. So even if you do that high intensity exercise for 10 minutes or 15 minutes, 3 days a week, that's been shown to give tremendous benefit. So it doesn't have to be a long time. So maybe alternate, the slow exercise days with the high intensity days and do each one 3 days a week. So that's 6 days a week total. Maybe have one day totally off. I recommend you do resistance training too. Very important, and this can be done several times a week. Also, should be done several times a week. Also, the best way is in a gym with a bunch of equipment. But if you don't have access to a gym, I don't think that's an excuse. You could do a lot of things at home with little or no equipment. You can use dumbbells or resistance bands to work out any muscle in your body. And you can even use your own body weight for exercises, push-ups, sit-ups, and even just practicing getting up out of a chair. For people, that are older, that is the number one thing to worry about is, especially in Parkinson's, is, more gait disability, more gait dysfunction. A lot of people end up with walkers and canes and wheelchairs. It happens slowly over time. If you want to avoid that, I think the best way is to keep these muscles very strong. That means you have to do resistance training. So you got to keep your muscles strong. Again, if you don't know how to do that, get a trainer, get a personal trainer. There's lots of videos on the internet that you can pay a small fee for or even watch for free. The last type of exercise I recommend is stretching. And it could be simple stretching of muscles, but ideally, better ways of stretching would be yoga, Pilates, or Tai Chi. Because in addition to stretching, they also emphasize, balance and range of motion, and you're practicing your balance, you'll be better at balance, and balance is impaired in Parkinson's. Parkinson's makes you stiff. Stretching, combats that, counteracts that a bit. So all those types of exercises I think are important. They all have different benefits, and the benefits are additive. So you do all three, you get like 3 times as much as if you just do one of them. The last pillar of health, as I call it, is stress reduction. I wish we had a pill for that, but we don't. If I do develop a pill for that, I think I might be able to retire early. But until then, I think we'll have to do these things. Do fun activities with friends and family. That's the best way to do it, to reduce your stress. Exercise is a great way to reduce stress. Sleep. So, a lot of these things are tangled together. So, exercise helps you sleep. Sleep helps stress, so they all kind of go together. Eating healthy also reduces stress. A lot of foods are inflammatory, make you feel bad. That can be very stressful. Make sure you have some calm, peaceful time every day. I think we overlook that in our society, but if we can make time, even if it's just 10 minutes to go in a quiet, dark room, do some nice, slow, deep breaths, that can be very relaxing, and that's totally free and easy to do. And then lastly, I recommend meditation. And I was pretty hokey about, I thought that stuff was kind of hokey just a few years ago. I really did. And I used to think meditation was just for monks, or something like that. But really, it's really going mainstream, and there's easy ways to meditate now. There's these apps listed at the bottom that you can get for any smartphone. They come with a very nominal price. And there's the world's experts are on these apps, and they walk you through individual meditations that you can do hopefully once a day. Again, they're short, 10 minutes usually, something along those lines. And what it involves is just a session where you sitting there, relaxed, could be sitting or lying down. And usually it's some deep breaths followed by just some guided thoughts. And mindfulness meditation helps you clear your mind of all these negative thoughts that we have, these things that we worry about that are probably never going to happen, or things that did happen in the past that we can't change. So it helps you basically live in the moment and have a clutter-free mind. And you can develop those skills, but you can't just want it and make it happen. You have to practice. And yeah, I think you have to have experts guide you in how to do that. So I've been very pleased with, how that's helped me personally and a lot of my patients. And many scientific studies show the benefits of this. This is not just people saying how they just think they're better. I mean, this has been scientifically proven to help markers of, health. All right. So that is really it. I will now, I guess we'll start the Q&A session.
Yes, thank you so much, Dr. Calegan. I can't stress the importance of the 4 pillars of health that you've just outlined for us. So I thank you for sharing your knowledge with our community across the Gulf Coast region. Of course, if we could bring Blair and Annie back here, and we'll begin our Q&A session. So we do have quite a few questions to get through today. And it's just in my experience, as the questions start rolling, it starts inspiring questions for our web audience. So please feel free to submit your questions in the Q&A icon, and we will try our hardest to address each question that comes in. So to begin with, Annie, I would like to start with you. Someone writes us, could you tell us a little more about how you're training hospital staff on being more familiar with Parkinson's?
Absolutely. So we're doing this in a number of ways. So first of which is that group of Aware and Care ambassadors that I mentioned. We've got 100 volunteers scattered across the country who are charged with educating the Parkinson's community, educating clinicians who treat Parkinson's, and going in and working with their local hospitals to change how care is provided and the culture around treating people with Parkinson's in the hospital, helping make sure that nurses understand the importance of that medication timing, and that, we're not trying to say that they're bad at their jobs, that this is just what their patients need. And the other way is actually through our PT and nurse faculty scholar programs, which Blair has gone through, where we are working on training physical therapy and nursing professors to teach Parkinson's more intentionally. And part of that includes the importance of medication timing and how to better care for people in the hospital. So the nurse faculty program has educated hundreds of thousands of nursing students through the nurses who have participated. And the physical therapy program is newer. It's not quite as many students, but it's just as impactful. And we firmly believe at the foundation that, we need to tackle this hospitalization issue from every angle, working with people with Parkinson's, working with the clinicians that treat them, working with the future clinicians in school, and even working with the electronic medical record companies and looking at the groups that oversee hospitals as a whole. So we're definitely doing more than just getting the information into the hands of people with Parkinson's. But until we've solved this problem, we want to make sure that you're all prepared in case of a hospitalization.
Thanks, Annie. Blair, next question I have for you. What to do if chronic back pain prevents exercise for an adult person with Parkinson's?
That's an excellent question. And I think this goes back to why it's so important to reach out. I think that's a great opportunity to talk to your doctor, get a PT on board to really help make sure that it is individualized to you, because that is one of those confounding kind of variables that would change what your exercise program look like. But we can find a way to exercise so that you could still get that benefit.
Thank you. Dr. Calegan, someone writes me, I can't sleep at night and I'm hesitant to add another pill to my regimen. What would you recommend?
The last thing I recommend is adding another pill. Well, I recommend all the sleep hygiene habits that I talked about. I mean, I think it's important to You can research that on the internet. Just Google, good sleep hygiene habits. I give a 5-page handout to almost all of my patients with all these recommendations. So just avoid caffeine, avoid alcohol at bedtime, exercise every day, have a good routine. Make sure the conditions in the bedroom are ideal. Don't eat or watch TV in bed. Have a wind down routine before you go to bed. Practice meditation. I mean, all those things are important. So I would do all those things first. Oh, and no caffeine. If you have that much trouble sleeping, 0 caffeine.
So I'll just share with everyone that today's presentation has been recorded, and you will be able to access the recording from today's event, but by our YouTube channel or through the Parkinsons.org webpage. So you'll be able to access the presentations today from our experts and get that information directly from Dr. Calegan's presentation, Blair's, and/or Annie's. Blair, one question that came through, why is it important to monitor blood pressure during exercise?
That's a great question. Some of the changes that go with Parkinson's disease can make it difficult to manage blood pressure. So they can have issues with blood pressure dropping, or if there are other underlying issues that could be at play. So if you're having trouble with blood pressure, it could be something that would influence how you exercise. So we would need to talk to your medical team to make sure that there wasn't any other underlying cardiovascular component. If it was an orthostatic hypotension where that blood pressure was dropping during exercise, or something that we would want to work together with a medical team to get the support you would need during that.
Thank you. Dr. Calegan, someone writes us, when I stand after sitting for a small amount of time, it seems like my brain is telling me to move, but my feet don't always move. It's caused me to fall several times. Is this normal in Parkinson's?
It's common in Parkinson's, so that's called freezing of gait or start hesitation. So very common phenomenon where you want your feet to move, you're telling your feet to move, but they seem like they're stuck. So that's why we call it freezing, because it's like they're frozen to the ground. And it can be just for a second or two, or some patients have it where it's more prolonged. So very important to tell your doctor about this. A lot of times it does respond to medication, but for some people, especially if Parkinson's has been there a while and it's sort of more advanced, sometimes it does not respond to therapy that well. And I'm talking about medications, but there are non-pharmacologic ways of treating freezing of gait that I'm sure Blair knows all about this, but sometimes you can have visual cues to help you overcome the freezing. For instance, you could just step over a line that's on the floor, or you can even just imagine that there's something on the floor like a stick and you're stepping over the stick. They have fancy canes and walkers that have lasers at the bottom, and you press a button at the top, it shoots a little laser by your feet and you step over the laser. So those are all kind of sensory tricks to overcome freezing. Doesn't work in everybody, but a lot of people, those things do work. So I hope that answers the question.
And Blair, if you'd like to add anything, please feel free.
No, I think I would just reiterate what Dr. Calegan said. I mean, I think there are a lot of different strategies that you can try and use to see if there's something that would help, like the lasers or like those sensory tricks to kind of help you get going.
It's also common for that to occur at a threshold. So at a doorway, people will all of a sudden their feet will start sticking and freezing by a doorway, or by going from one room to another. So a change in scenery or a change in the flooring, or stress even, but it's more likely to happen when your Parkinson's medicines are worn off. So ideally you want to talk to your doctor about minimizing the time per day that the medicines are not working. So, we call that off time. So you want to minimize your off time and maximize your on time when the medicines are working. And that will make the freezing probably a lot less likely to occur.
I just want to echo, the best thing you can do with freezing is work with a physical therapist and talk to your doctor. It's such a common problem. We hear about it all the time.
Mhm.
Annie, since I just got you off the mic, someone writes in, it has not happened to me before, but how would you convince emergency staff to take a look at the Aware and Care kit prior to providing care, or making sure that medical staff are taking the kit seriously?
So this one's challenging. We try to do our best to make sure that we plaster our logo over everything so that it looks really official. And I think the key is really to approach this confidently, assertively, but understandingly. So, emphasizing, that the reality is a lot of folks who don't work in Parkinson's 24/7 don't understand some of the intricacies. It's a very complicated disease. And so this is what the Parkinsons Foundation gave to me to share with anyone providing care in the hospital. And the other thing to keep in mind, if they're not listening, you can ask for a hospital-based advocate. You can mention that, you're displeased with the quality of care. There are some buzzwords you can use that will raise flags for them to say, oh, I guess I do need to listen to this person. And the last thing I'll say is don't give up. Keep advocating for yourself, because this really can mean a negative hospital experience. It can mean that your stay can be extended in the hospital by days or even weeks. And it can take months sometimes to get back to where you started if you have one of these really bad spiraling out experiences where you don't get your meds on time. So they give you that medication you shouldn't be given. And so all of your symptoms get so much worse. It's a good thing to stand up and be bold while you're doing this, and try to just remember, I'm not being unreasonable. I'm educating them, and I'm asking for what I need.
Absolutely. Absolutely. Dr. Calegan, does levodopa-carbidopa cause discomfort in the feet? And they write more, I've been diagnosed for about a year. Is it the Parkinson's or the medication that causes this pain? I've only had the problem since I began medication.
There's not a simple answer to that, but I'll maybe give a few scenarios that might explain why somebody would have discomfort in their feet. First of all, if you're not on enough Parkinson's medicine, that can cause painful cramping. So if this person is referring to cramping of muscles in the toes especially, and especially if it's first thing in the morning, that's probably what it is, because first thing in the morning is typically when the Parkinson's drug levels are at their lowest. So that's when you're most likely part of the day to have a low dose of medicine in your body, and that can lead to Parkinson's motor symptoms acting up and causing cramps. So that is one, I think that's the most likely explanation for what this person is referring to. But in the event of too much medicine, then people can get dyskinesias, which are, fidgety type movements. And that can cause discomfort in the feet if you're having dyskinesias in the feet. So really, you can have discomfort in the feet from too much medicine or too little medicine. They cause different types of exact motor symptoms and different types of movements, but both can be uncomfortable. And then finally, more recently, there's been a link of peripheral neuropathy to Parkinson's disease. It's not a super strong link, and I don't think we understand a lot about it yet, but somehow, some way, it's possible / likely that Parkinson's disease may contribute to nerve damage in the feet, and that can cause numbness, tingling, burning sensations. Okay.
Great, thank you. Thank you. So this could go for you, Dr. Calegan and or Blair. Since COVID, I have stopped going to the gym. Should I take the risk and go anyway, as I really like working out there?
I would say you don't have to go to the gym. Please don't use that as an excuse. You can do things while you're watching TV. You can get dumbbells and work out while you're watching Netflix. You can stay in there. You can hold on to something if you have balance problems and just practice doing little squats. Okay, practice standing up. And if you can go all the way down without any weights, add a little weight. Hold some dumbbells or get a resistance band and give yourself some extra resistance. You can wrap those bands around furniture. You can work out every muscle in your body that way if you just be creative. And there's YouTube videos that'll show you, or better yet, good physical therapists like Blair or a personal trainer. You don't know what you're doing, get professional help. I mean, that's true with everything in life, right? But please, don't use cold weather or transportation issues as an excuse, because you need that exercise. You really need it almost every day, and it's that important. And we'll see what Blair has to say, but that's my 2 cents.
I would just wholeheartedly agree, is that, that exercise is such a vital part of your management and with Parkinson's, that it's not really optional. And so there are a lot of ways that we can get it. You can, absolutely exercise in your home. I mean, things like sit to stands or squats, or, they do a lot with a little, I mean, I love those, because I always say that they're like my powerhouse exercises, because I get strengthening. I can get a lot of different, they're functional. So if you don't know where to start, reach out, get a trainer. Your PT can absolutely help. There are a lot of other resources. I think they posted a link for, their Fitness Fridays in your chat box as well. So, even if you could do socially distanced walking, or socially distanced, something with a friend outside potentially as well. So you have to kind of think about, again, going back to what works for you and what works in your situation. But there is something that we can put together that would work in that regard.
I actually found when COVID restrictions came, I couldn't go to the gym anymore. So I really started doing a lot of things at home. And honestly, I'm kind of mostly doing stuff from home still, even though the gym's open again. But I find that I'm in better shape since the gym closed, because I am able to do things at home, and I'm home all the time. So my quantity of exercise has increased, even though it may not be quite as intense as it was in the gym. I'm doing so much more that I'm in better shape. So sometimes it can be a very positive thing, and you can learn to do things differently, and that usually just helps give you more options.
Absolutely. And I think the creative component about home exercise too is another element of just exercise in and of itself, is getting creative. And the Parkinsons Foundation does host Fitness Friday classes every Friday each week. We have hundreds of archived exercise videos adapted to people with Parkinson's disease at different levels of advancements in Parkinson's disease, from Tai Chi, yoga, rock steady boxing, if you guys are interested in punching some bags or just the air. So there are exercise videos that you can use to inspire that creativity at home. And just echoing what Dr. Calegan and Blair have said here, is just do the exercise. Don't give yourself an excuse, because exercise is the number one thing you can do to help relieve your Parkinson's symptoms.
And helps you sleep, and it helps your mood, and it helps your balance, and just helps everything.
It helps it all, right? And I always tell people, anyone who's not living with a chronic illness, the doctor will ask you, how often are you exercising? Even more so important with someone who is living with Parkinson's disease. So Dr. Calegan, I have to ask, because this question comes up every event that we have. What has been your experience of CBD and or marijuana and Parkinson's disease? Do you have suggestions or recommendations to share?
I do. I do get asked that question a lot. So I did speak about that at a Parkinson's conference here in Baton Rouge a couple years ago. And the video's on YouTube. If you just Google Dr. Calegan and CBD oil, you'll find it. There's been some updates since then, but I'll summarize it basically. There's been a few really good studies to date on CBD oil and Parkinson's, and unfortunately they've been negative, so they did not show a benefit. However, I do think there's a lot of potential there. I think we need to study it in different patient populations. We need to study different indications, different doses. So it probably is beneficial. We just maybe hadn't figured out the exact dose or the right people that would benefit. I saw one study recently that showed very high dose CBD oil does help tremor, but it wasn't a big double-blind randomized controlled trial. It's intriguing, but the dose of CBD they used, I think, was 100 milligrams a day or more. Very expensive. If you were to buy that much, it'd be maybe like $50 a day or something like that. So most people are just not going to be able to afford that. Plus, you should never start with any dose that high. You would work up to that. But I would say low dose CBD oil is pretty safe, although it does interfere with some medicines. So make sure you talk to your doctor first. Some blood thinners, especially some antidepressants, it can interfere with. But in general, CBD oil is safe. And it has been shown to be helpful for insomnia, for anxiety, for pain, for muscle spasms. So obviously, Parkinson's patients have all those problems, but overall has not been shown to help the disease. Maybe some specific symptoms, but I would be very careful with medical marijuana THC products, because THC, makes you high and alters your sensorium, your thinking, and it can make you hallucinate. And Parkinson's patients already have a tendency to get confused and hallucinate. THC will 100% make that worse. And it makes you clumsy, impairs your motor function. So you'd be more likely to fall and get hurt too. So I would be extremely careful with THC products. Consult your doctor first. THC, be very careful because of the things I just said, but CBD, a lot safer, but just not been shown to be as helpful as we hoped yet.
So thank you so much for speaking to that. It is a question that's frequently asked to our helpline, and we often find, the answer is there's not enough research. And
one thing I want to say, I'm sorry, this question hasn't come up, and I really should have probably had this in my talk, but it's relevant to the COVID issue. People may want to know if there's supplements they should be taking to boost their immune system. And I did a webcast about 6 months ago for COVID, and I said, don't worry about supplements. I don't think they're really that helpful, but I've kind of changed my mind a little bit on that. I think zinc supplements can help the immune system for sure. I think vitamin D3 helps the immune system for sure. And I think 5,000 units of D3 is pretty safe for 99.9% of people and will not give them a mega high, blood level. But almost everybody I check vitamin D is low, even the people on supplements already. So vitamin D3, zinc, and vitamin C is another good immune booster, 500 to 1,000 milligrams once or twice a day. Other things that can help immune system are curcumin, vitamin E, and fish oil, omega-3 oils. So those things could be helpful for the immune system to help protect against, COVID and other infections.
Now, is there a place to say, of being cautious of where you get your supplements from? Because
Absolutely.
they're not FDA regulated?
Yeah, supplements are not regulated by the FDA, so you really have to research the company and make sure it's a reputable brand. You can check to see if they do independent third-party testing and post the results. That would be good. If they posted that would be impressive. But I mean, a lot of times you just kind of, I would be really careful about buying the cheapest product. The cheapest product is probably not going to be the best. So spend a little extra money, maybe do a little extra research on a reputable brand. So that's my 2 cents there.
Great. Yeah, I just wanted to make sure we mentioned that. And I like that you said buying the cheapest brand isn't necessarily the best idea.
Probably not the best.
Yeah, the research needs to happen before we just purchase all these supplements and knowing where they come from. Dr. Calegan, I got a question here, and it's very simple, but it could be quite the complex answer. But I have someone asking, can I go medication free?
No.
Okay.
That's a really bad idea. So we have great medicines to treat the motor symptoms of Parkinson's disease, the tremor, the stiffness, the slowness of movement that occurs with Parkinson's. We know that even if treatment is delayed by a little bit, several studies have shown that people who delay treatment and start later don't catch up to the people who started medicine kind of when they should have. So that implies that you sort of accumulate disability if you're undertreated, and you can't just catch up later. It can be sort of permanent, some of it. So don't avoid medicine just for the sake of avoiding pills. I mean, no doctor is less likely to avoid giving you a pill than me, but I give a lot of pills for Parkinson's disease because if you don't, it's overwhelming evidence that you do poorly and you accumulate disability, and you probably won't get all of it back if you wait. Before we had medicines, people did not do well with Parkinson's at all. Just watch the movie Awakenings. And the advent of levodopa was a godsend in the 70s and 80s, and we still don't have a medicine that nearly as good as that. So please take your medicine. Now, people all the time, not all the time, but it's happened many times over the years, people understand you're sick of taking all those pills, and they just one day decide, screw it, I'm not taking my pills anymore. And they stop taking their pills, and they call the office the next day and they go, guess what, doc? I stopped all my pills and I feel great. So there. And I go, great. I don't recommend that, but I think there's a good chance in the next few days it's going to start to catch up with you pretty badly, and it always does. So just know that, you can feel good for a few hours or a few days without your medicines, but the longer you've had Parkinson's, the worse of an idea that is. Plus, if you're on a high dose and you're abruptly stopped, that can actually be dangerous. It's rare, dangerous complications to abruptly stopping high-dose Parkinson's medicines.
Yes, I was just going to jump in and say that and emphasize the same reason that we want you to get your meds on time in the hospital is why you shouldn't stop those medications suddenly at home. And the other thing, taking meds, even when your symptoms are mild on the early end of the disease, will make you more able to exercise more and do more of the things that keep you more active throughout your disease progression.
Thanks, Annie. Thanks, Dr. Calegan. So we've got time for a final question. Has any consideration been given to seeking a drug like Tamiflu for the flu for COVID to lessen the severity of its symptoms and shorten the duration of the disease?
Yeah, of course, we've looked at many drugs to see if they help reduce the severity of COVID infection, like remdesivir and hydroxychloroquine have been two of the most prominent medicines mentioned. I think remdesivir is actually approved now, and there's some evidence for and some evidence against hydroxychloroquine. And then there's the antibody therapies that are probably extremely helpful. But we just, they're looking at all types of medicines for COVID, really. So it's just a matter of time before they find a vaccine and also treatments for acute infection.
All right. Well, thank you all so very, very much. We couldn't have not made this program possible without each of your wisdom and knowledge, and of course your time. So I sincerely appreciate you guys offering that to here at the Parkinsons Foundation and across the Gulf Coast chapter into our Gulf Coast Parkinson's community. So thank you all so very much.
Thanks for having me. My pleasure.
I'd like to just invite everyone, as Dr. Calegan kept alluding to meditation. So the Parkinsons Foundation does host a weekly meditation for our Parkinson's community each Monday at 12 p.m. Central Time. So if you're interested in exploring a meditation practice, a mindfulness practice, I would strongly encourage you to start with us at the Parkinsons Foundation with our mindful Parkinson's community across the world. It's really quite a beautiful space to explore this practice. We also have our Wellness Wednesday programs each Wednesday, again at 12 p.m. Central Time. So if you enjoyed today's program, please check out what we're going to be targeting for at the end of the year by visiting parkinson.org/pdhealth. And of course, staying up with the fitness, exercising at home, using some of those exercises that Blair offered us today in her movement demo. And of course, the urgency that Dr. Calegan is providing to all of us is move, move, move. Stop giving yourself excuses. We have the resources here to help guide you through a fitness regimen from your home. So please visit parkinson.org/pdhealth to find your exercise, the one that you will do. And I'd like to just thank our sponsors one more time before we close here. Thanks to UCB, Boston Scientific, Amneal, and Medtronic for their support. Our programs would not be possible without the support of our sponsors, so thank you so very much. And finally, I'd like to thank each of you for joining us today, for taking the time to learn more about your journey through Parkinson's disease so you can be empowered and equipped and just, ask the questions that you need to ask and to get answered so that we can provide you an opportunity to live better with Parkinson's disease. Please stay engaged with the Parkinsons Foundation. We do have a webpage dedicated to your region, parkinson.org/Gulf Coast. This is a webpage where we have dedicated resources, support groups, exercise and wellness programs, experts like Blair herself across the region who are educated and understand people with Parkinson's disease. And as always, our helpline is available to you if you need any guidance, support, direction, care provider recommendations, and that telephone number is 1-800-4PD-INFO. And I'd just like to say thank you again to Dr. Calegan, to Annie, and to Blair so much for your time today. I am so grateful to have met each of you and been able to create and host this program to feature and share the knowledge that each of you have. So thank you so very much. And I guess until we'll see each other again in this virtual world, everyone be safe, stay healthy, keep moving, and meditate. Bye-bye.